CNN medical analyst and emergency physician, also formerly the Baltimore City Health Commissioner. Good morning, Dr. Wen. You wrote a really interesting piece about, the fact that we need to focus more on how incredible it is to be vaccinated. Right? And I understand, and it's very serious what's been happening for some people with the J&J vaccine.
Yeah, and they're probably all stupid Trump supporters.
But for the vaccines on the market right now, speak about your concern that not enough is being made of the incredible rewards for it.
This is an important breakthrough. I mean, many people don't realize we're probably going to have booster shots for this vaccine for the rest of our lives.
And what we're up against, which is in a few weeks, more vaccine than people who want it.
Right, Poppy, but I am hearing this very dangerous narrative building of people saying, well, what's the point of getting the vaccine if reinfection or these breakthrough infections could still happen if we have to get booster shots? And by the way, there are these blood clots.
Holy shit!
I really don't think that we as the public health community and also as the media are putting the emphasis in the right place, which is to really discuss the incredible scientific breakthrough that these vaccines really are. I mean, now we have growing evidence that the vaccines are so effective in the real world. The CDC report that came out last week found that there were 5,800 cases of breakthrough infections, people who got vaccinated but still got infected.
Wait, what?
That sounds like a lot, except when you compare that it's 5,800 total breakthrough infections compared to every single day we're having 60 to 70,000 new infections daily for those who are not vaccinated. And I think we really need to be telling the story of how effective these vaccines are and how they will be our path out of this pandemic.
Yeah, I mean, people are still dying, right? And the data shows this saves lives. Yourself, your family members, your co-workers. I do want to ask about this new data on the Johnson & Johnson vaccine. The headline figure, 66% efficacy. And we're a bit spoiled now, right? Because, Moderna and Pfizer, 90, 95%. We kind of expect that to be the standard here. But when you look closer at the data, does that efficacy number actually increase over time the further you get out from the day that you get the jab?
Yeah, that's right, Jim. So it does look like that there are two things. One is what Elizabeth had mentioned, which is this study is an international study. And so we're also seeing that the Johnson & Johnson vaccine is effective against the South African variant, the B1351 variant.
And that variant is smart, and it managed to some extent outwit the vaccine.
The second thing is that the vaccine does look like that it substantially increases in effectiveness from 14 days to 28 days. So after 28 days, there's an increase in effectiveness. And it may well be that we need to let people know that with Pfizer and Moderna, you have full protection 14 days after your second dose of those vaccines. After Johnson & Johnson, maybe we should be telling people you have optimal protection 28 days after your one dose.
Yeah.
Pregnant women. You were pregnant, going through a lot of this by our side, going through a lot of COVID by our side. And obviously the vaccinations came out after you'd already given birth. But the fact that the New England Journal of Medicine says now that they have found no safety concerns among pregnant women with the Moderna or Pfizer mRNA vaccines. How big is that?
I think it's huge because we know that pregnant women are at increased risk for severe outcomes from COVID-19. Higher rate of being hospitalized, higher rate of being in the ICU, higher rates also of preterm births and consequences to the mom and the baby. And so a lot of pregnant women have been wondering, well, should I get the vaccine? It wasn't initially studied in clinical trials, so is this safe? Well, now we have this new evidence, a study of 35,000 pregnant women who have received either the Pfizer or Moderna vaccine, and there were no dangerous safety signals that were found in more than 35,000 pregnant women. So I think this really gives a lot of confidence in our advising women that yes, this is something that you should consider very seriously to protect you, to protect the baby, and also to protect others around you too.
It's a pretty remarkable place to be, a little over a year after we first identified this pandemic, that you have tens of millions of Americans vaccinated. We've got 3 workable vaccines. They're life-saving. They're safe for most people. It's good news. We should acknowledge that.
Now, Brown noser. The nose is brown. Why? Well, similar to ass kisser, the brown noser is kissing the ass and they get some shit on their nose because they're always kissing ass.
That's exactly right. And I think that at this point, we really need to focus on increasing vaccine acceptance because the Biden administration, working with local and state officials, have done such a good job with increasing supply of the vaccine, increasing the rate of administration. But now we really need to increase vaccine uptake.
Dr. Wen, thank you.